Okay. Hi, everyone. Welcome to the June 29th COVID call. This is Melissa Seltwick, the Assistant Director of the SASH program, and I'm going to go ahead and hand it over to Molly to get us started. Oh, it looks like maybe Molly might be on mute.
It doesn't look like she has audio, actually. There's no little audio symbol, so.
Okay. Well, we'll go ahead and wait for that to come through, and while we do that, I will move us on to questions. Please, as usual, chat in any questions that you might have that you're hoping we can cover on today's call. I know we have a pretty packed agenda, so we will do our best to try to get to any questions you may have. Please feel free to use the chat feature throughout. I do read through the chat after the call, and I do my best to try and answer any questions that we didn't get to during the call. Molly, when you're able to, just chime in and let me know that you're here, but I'm going to keep us moving along. So taking a look at the numbers, it looks like the thing that stood out to me the most, honestly, about this is that we're all coming in right around the same percentages. So I know that a while back, someone had asked me to add the percentages to these numbers to give us a sense of sort of where we are as as a whole, and I think that was really helpful. I see that Vermont has tested a little over 10% of our population. Minnesota has done the same. Rhode Island has tested 21% of their population. So Rhode Island is definitely getting some more testing going right there. And I was trying to figure out if that's because there's a lot of urban areas or maybe they just have more access. I really don't know. It does look like the numbers of positive cases do continue to grow, whereas in Vermont, the number of fatalities has not risen very much in the last few weeks. So these are the numbers as they stand right now. I know that as a nation, we have topped 2 million positive cases since our last call. Casey, do you want to talk us through risk factors for severe COVID?
Sure, thank you. Hi, everybody. The CDC came out with some new guidance around who is at risk to get the sickest from COVID-19 and potentially end up in the ICU and potentially die from this disease. So one of the changes in their guidance is not just over 65, but that risk rises with age. So somebody who is 90 is at higher risk than somebody who is 70. Which makes sense, but as the older you are, the more at risk you are. Obesity is now on the list, which is important because up to 40% of the adult U.S. population is considered to be obese. So there's certainly a lot of people at risk based on that. Kidney disease, COPD, type 2 diabetes, heart conditions, and immune system disorders, sickle cell disease, and another new addition to this list is pregnancy. Not that people who are pregnant are more likely to die from COVID, but more likely to need ICU care. So definitely a concern with that for younger people. I think that is all I wanted to say on that slide, but these are some changes and kind of highlight who might be getting sickest and who needs to be thinking about taking more precautions right now. Go to the next slide, Melissa. Oh, I did want to also just mention with that also that there are other risk factors that aren't on the list but are definitely connected with higher risk, including asthma and high blood pressure, dementia, and history of stroke. So even though those haven't been added to the list, they are mentioned on the CDC site as well. Sorry, go ahead, Melissa. So there's also been some new guidance about how COVID-19 is spread. the majority of spread is now believed to be airborne, so spread from person to person through respiratory droplets, like when an infected person coughs, sneezes, or even talks. So these droplets then land in the mouth or nose of people who are nearby or possibly inhaled into the lungs. So obviously that spread is more likely if you're closer to somebody, and masks help prevent the airborne droplets to be spread as far. It contains them. So staying that 6-foot distance is really important. Wearing the mask is really important. If somebody is coughs or sneezes in a room, they could be in the air for quite some time because droplets are very, very tiny. There is still the possibility of contact surface spread. It's believed at this point that it is not the primary mode of transmission, but it is possible that a person can get COVID by touching a surface that the virus is on and then touching their own mouth or nose. But it isn't thought to be the main way the virus spreads. So while it's definitely important that we continue to wipe things down, it's probably more important that we're keeping distance and wearing masks. Next slide.
Thanks, Casey. So as we're all at different stages, all 3 of the states that SASH is in currently. So I don't in any way with the title of this slide mean to be saying that we are through the first wave, because I know that many places aren't. I'm not even positive if Vermont is yet. But what I do know is that in Vermont, we have a little bit of breathing room right now, and we're able to take a look back and see what worked, what didn't work, what we would do differently should this happen again, where we all have to retreat, to our homes. So we thought we would start this with a poll, and I'm going to do my best to see if I can make this work. We have 3 of them, so everybody please chime in with these answers. Let me see if I can make this happen. Hold on. Okay, so the first one, I'm going to launch it. It's what were the biggest needs for your participants over the last 3 months? So go ahead and you can choose as many as you want. So if they were all a need, you can obviously put that, but if you can let us know sort of what the biggest needs for your participants were over the last 3 months, that would be very helpful. We've got about 40% voting right now, so I'm gonna give it a few more seconds. Try to get to 80%. Let's say we're at 67% right now. Oh, we just jumped up, and all right, we've reached 80%. Thank you guys so much. So I'm gonna give it another 5 seconds. 4, 3, 2, and 1. Okay, so we reached 88%. That's awesome. I'm gonna go ahead and close the poll, and then I don't know if you guys can see, I can publish. Amy, maybe you can help me.
I jump in too, Melissa, and just ask that people chat in if there's an other. If you're seeing things that aren't on this list, please chat that in.
Thank you so much. The poll limits me to 5 choices. So you're going to see that things kind of got sort of smushed together in ways that maybe weren't ideal, but will help us get an idea of what's going on. So it looks like social isolation by far and away was the biggest concern, followed by confusion around COVID-19 and access to food. Then with unmet mental health needs, and lastly, lack of medical care. It looks like people are chatting in. I see a lack of physical exercise. And what was the percent under COVID? I'm not sure that I understand, Paul, so maybe give me a little more to go on there. But thank you for that. That gives us a really great idea of where things were at. I'm going to try and launch the second poll here. And the second poll is more asking, what is the biggest need? Can't see the 5th item. Oh, okay. I'm not sure if I can get back to that screen right now, Paul, but I will definitely share the results afterwards. So now the next question is, what is the biggest need your participants have right now? So now that maybe things are changing a little bit, oh, thank you, Kathy. What is the biggest need that they're facing right now? And so I will go ahead and launch that. And we'll give it a couple minutes here for everyone to chime in. Again, you can pick as many of these as are relevant. We've got about 50% of the people voting right now, so I will again try to get us at least up to 80%, and I will give it another few seconds here. All right. We've hit 82%, so I'll go ahead and close the poll in 5, 4, 3, 2, and 1. Okay, we reached 84% voting on this one. And on this one, it looks like, again, social isolation takes the cake, followed by foot care, physical or mental health, confusion or misinformation about COVID, and access to food. And then I see is there anyone else that can help me with some of the chats that are coming in on this?
In transportation, fear, people getting infected, lack of muscles are failing due to lack of exercise and walking, lack of exercise. So exercise is huge.
It is, and you know what's really funny is that was originally on Casey's list of things to put on here, but I took it off because I didn't have enough room for all of them, so I guess maybe I should have left that on. But thank you guys for chatting in. Okay, and then the last poll that we're going to do right now is, if I can get it to work here, hold on a second. Oh, okay. What were your biggest challenges over the last 3 months? And again, I think you can pick multiple choice on this, so I guess pick all that pertain, but maybe think about what ones were the most challenging for you. Okay, so we're at 50% voting right now. We'll leave it open for a few more seconds. Try to get to that 80% at least. Okay, we've got 76, so I will go ahead and close the poll in 5, 4, 3, 2, and 1. Oh, yay, we got 81% right there at the end. Awesome. Okay, so it looks like concerns about participant health and safety were the biggest thing that you all were worrying about over the last 3 months, followed really closely with technology issues, balancing work and family needs, and concerns about mental or physical health of yourself or your family, and then 11% with not feeling supported at work. Okay, so now I am going to try to close the polls and get back to where we were with our audience view. All right, looks like we did it. Okay, thank you guys so much, because I think this is just us really starting to think about what worked, what didn't work, what would we do differently if we were to have to do this all again come this fall. And I think, Casey, if you want to talk us through sort of this just initial thought process here.
Sure. This is just a kind of a brainstorm on things to think about right now as we prepare for a possible surge or for an outbreak in your area, and how to help both ourselves and our participants be ready for that, especially now that we're in a lot of places able to be actually meeting with people face to face. So we can help people with technology and getting connected with telehealth. You know, if somebody really struggles with telehealth during this time, this might be a time to sit down with them and help them figure out how to do that. Helping people, excuse me, address their medical needs now, get them in to see their doctor, get them connected with their doctor. Anything we can do to boost health of participants. Todd mentioned earlier that vitamin D, being low in vitamin D is definitely a risk factor, and we're hearing more and more about that. So helping people get some sunshine, talking to their PCP about vitamin D supplements, that kind of thing, could be a real important way to boost their health right now. Also, talking with your primary care offices, talking with your SASH teams to coordinate and discuss what went well, what can we do differently, what's their plan for the fall or for an outbreak, and So really opening up some more communication between teams could be really useful right now. More masks for everyone. Definitely talking with participants who really struggled and what they can do for themselves to have a better plan. Maybe it's getting some more exercise equipment into their home, or have some more ideas on how to exercise at home if exercise was a big thing for them. If food was a big issue, what different systems could be set up so that that's better available for them. We're going to be hearing a lot about flu shots. Flu shots is going to be huge. We have a couple of slides on that coming up, but get your own flu shot and can work with participants to get their flu shots. There's going to be alternative ways, I hope, of that happening as opposed to the flu clinics that a lot of people got them in the past. Learning more about PPE, getting a supply of PPE. There's still shortages of a lot of that, and we certainly don't want to be hoarding it when people don't have enough in the South, but having a reasonable amount handy. Talking with your coworkers, talking with participants about their experience. Again, I think that's an important part of planning for everyone. I would definitely encourage some sort of emergency plan at every DRO. That research plan that we've shared is up on STAR, working on that during this time, doing the scenario planning as we've talked about. The scenarios are up on STAR, and being prepared for a shutdown within 24 hours and talking about what that would look like and what does that mean? What does that mean for your panel? And hopefully this won't happen, but if we're prepared, then we'll be ready for that. And help participants.
Sorry, I thought you were done. Go ahead.
Go ahead. Yeah, no, and I was just reading the last one, which was how maintaining that emergency supply. I think probably most people have used up their emergency supply, so trying to have a little bit of a buffer there for participants. I can see there's a lot of chats coming in, so.
Sorry about that. So a lot of them are about flu clinics, and I think we can just wait till we get to the flu slides to talk about those. Someone did mention, making sure to take care of the caregiver. So maybe now might be a good time to take a vacation or a break if they can. Someone else was asking about A1C testing kits that were ordered for some of the nurses. Do we know when those are going to be in?
We're still working on the best protocol for those, so they have not been ordered yet.
Okay. Lots of people asking us to share this document, which we absolutely will do after the call. Again, this was really just sort of our brain dump right now, so to speak, if you will, to get us started thinking about it, but I think we absolutely can share it. And then the questions just about flu clinics and can they be held on site. So I will push those to the flu slides.
I wanted to talk a little bit more about masks. It keeps coming. I mean, it's obviously a huge topic and it's all over the news. And the big question for me is, why aren't people wearing them? I didn't understand that. So did a little bit of research on some of the reasons behind it. We've certainly talked about health reasons, and we have some guidance to share to help people with that challenge when it either increases anxiety or causes shortness of breath. So there certainly are health reasons, but unfortunately there's a lot of other reasons why people are not wearing masks, and a lot of them, or at least some of them, are political. And there's a lot of mask refusers where there's the sense that masks are taking away their freedoms. There's people talking about not being muzzled, and without stepping too much into the political arena, that with having the president and the vice president mocking masks and telling people that masks are a sign of weakness, it makes it even more of a political issue. So there's a statement that some people are making that by not wearing a mask, they stand behind the president. There is also a lot around civil liberties and freedoms there's been more in the media around the challenge masks pose to masculinity, with some very prominent male sports figures being very vocally against masks in a lot of social media. And of course, there's also this constant reminder that when you're wearing a mask, you recognize that despite all the sacrifices that people have made, the pandemic's still here, and it hasn't gone anywhere. So there's a lot of reasons, and I think it really is helpful to understand somebody's motivation as we try to work with people around mask wearing. So what do we do about it? Primarily, shaming doesn't work. It doesn't work to call someone out for not wearing a mask. We've learned a lot about shaming from the other huge global pandemic of our time, which is the HIV/AIDS pandemic, and it taught the public health community that shame and fear-mongering is not effective in changing behavior. And so arguing with mask deniers really only solidifies their position. It shows how different we are, and it solidifies their stance. So instead, we need to work with people. We need to not be the mask police. We need to work on our relationships and our connection with participants, and listen to them. Tell me about what your beliefs are. Talk to them about it, and appeal to concern for others. So even if they are an adamant refuser for wearing a mask, you might be able to appeal to the concern about other people in their building with health problems, and that you're really worried about them, and you know they're a friend of yours, or that kind of thing. So appeal to that concern. Be a role model. Wear your mask. Praise people who are wearing it. Thanks for wearing your mask. I really appreciate that. It helps everybody. Give that positive feedback to people who are doing it, and set limits. If you're not going to meet with somebody, or you don't want somebody in your office if they're not wearing a mask, so they'll talk to you on the phone. Or if it's somebody who, for health reasons, can't wear a mask, as we talked about last time, wear a mask yourself and that face shield so that you can still meet with them. Because we do need to be careful that we aren't treating people differently and providing a service to one group and not another. So finding ways to do it over the phone or with a face shield is important.
So Annie just mentioned, which we've talked about on the call before, but some people can't wear them because they might need to read lips. And we have talked about maybe those clear ones that could possibly help with that, although I think a face shield would too. Becky says that she would change masculinity and add vanity. So I would say, people just not feeling comfortable yet wearing masks is probably definitely a part of it. Cindy says that, in all honesty, sometimes residents just walk out the door and forget to take them with them. I know that I have done that myself. Gone to walk into the grocery store and saw someone walking out with a mask, realized I wasn't wearing mine, turned back around, went and got it. So I think that it really is just a learning. We're all learning. It's new to us here in the US to be wearing masks out in public. And then in response to a request that was made on the last call, we did take all of this research that Casey did and put it in a letter that can be shared in your newsletter or in your Sash Flash with residents, that really just talks about how there are some reasons that people may not be wearing masks. It's really good for us to do so if we can. Some tips and tricks around how to start wearing your mask if that's a challenge for you, and then ultimately just to be empathetic and understanding, and we're all working through trying to get through this together. But this will be shared after the call and the email. It'll also be shared in the Beat. Please feel free to put this in your Sash Flash or in your newsletter, post it around your building, however you think this would be most helpful. Please feel free to share. Thank you, signs about wearing masks are a great idea. Perfect reinforcement, Jody says. MJ says, we have so many signs up that she doesn't think people see them anymore. I agree, MJ, and we've actually asked if Deb can work on sort of remarketing some of the signs just so that they look different. So that's something that I think we had worked on last time, and it would be worth checking out the COVID page to see if there's any new signs that you don't have, so that just the difference could capture someone's attention. Casey?
Yeah. I just wanted to add to that previous slide that I think the biggest way to get used to masks is really about practice, and wearing them at home for just a few minutes a day can make a really big difference for just getting used to them. I certainly know that has worked for myself and in my family. That practice is, like everything, is really important. Okay, next slide. Yeah. So similar to the mask issue, as there's more and we're hearing more and more about anger and verbal attacks against mask wearers and against mask rejectors. So people calling each other out in the supermarket, yelling at each other. There was an incident in my hometown that people were talking about where somebody wearing a mask was yelled at by somebody passing in a car. And so there's a lot of heightened emotions around all of this. Of course, there's death threats against contact tracers, against public health officials, against people who test positive. And I think it's really important that we understand that that's going on so that we can we can be really, really careful with privacy. As you know, there's an outbreak in Fairhaven, Vermont, and and government is not releasing the name of the business where that outbreak is, and that's because it's unsafe to do so. That there are threats and against people and businesses who have outbreaks. I think we talked last time about the hairdressers who potentially had exposed people, and nobody got sick because they were wearing a mask and were following proper protocol, but they got death threats because they had potentially exposed somebody while doing their job. So we really need to be careful with privacy. There's also a huge amount of attacks against Asian Americans right now because of the false beliefs and stuff on social media about this virus originating in China and as somehow intentional act against the United States. So there's a lot of concerns in the Asian American community and people being hesitant to seek healthcare because of that, and healthcare workers being treated really badly in a lot of cases. So my hope is that part of the pre-screening questions before we visit somebody is going to help keep us safe, so that we aren't in a situation as staff going in to visit somebody who might be somebody who's going to be very angry about this situation. Hopefully that will come out in our pre-screening when we talk to somebody, and we will get a heads up by asking them about possible exposure. And so we'll know before we go visit somebody a little bit about where they stand. Any chats on that, Melissa?
No, there was just a question about Fairhaven outbreak, and as of the last count that I heard on Friday, there were 12 people that were a part of that. It may have been updated since then, but that was the last that I heard. So with this in mind, I mean, one of the things that we've been asked to look into is really COVID burnout and also vicarious trauma. So this is, we're in 3 months right now, and it's been a long 3 months. So I did some research and I found this that was put out by the CDC. It talks about, and I'm not going to read through the whole thing for you. There is the link on the page is to where I found this. There's many articles out there, but I thought this one was really just straightforward. So recognizing the symptoms of stress that you may be experiencing: irritation, anger, denial, uncertainty, nervousness, lack of motivation, feeling tired or overwhelmed, feeling sad or depressed, having trouble sleeping or having trouble concentrating. I thought that was just really clear. Then there's also the common work-related factors that can add to stress during a pandemic, which I feel like we probably already know because we're living it, but it was a little affirming to go through and read it. Lack of access to the tools and equipment needed to perform your job. I think it was Diana Rule in the chat that just mentioned that one of the things that she struggled with was not having all of her files at home when she was working at home. Perfect example. That can cause so much stress because you know that one thing you need to see is it exists. It's in the file, but it's in your office and you can't get to it. So along with this, they also have tips to build resilience. And I think that that is key. We talk a lot about building resiliency with our suicide prevention work. And so it really spoke to me that they were talking about ways to build resiliency and manage job stress. And these are everything from just talking with your coworkers, identifying a typo, identifying those things that you need that you don't have control over, increasing your sense of control by developing a consistent daily routine, knowing the facts. I typed this up. There's a lot of typos in it. I'll fix it before we send it out. It does come straight out of the CDC article. There was just on each of these, there's lots of little additional bullets that you can definitely dig into, but that I couldn't fit on this slide. And then lastly is resources, knowing where. So there's the National Suicide Prevention Lifeline, the Domestic Violence Hotline, the Disaster Distress Helpline, as well as various resources from the CDC and COVID-19. I think that these could be helpful for our participants and for us. So I just wanted to share that. I think the article was very well written, and I would encourage anyone that may be feeling stressed out to check it out. The one thing, I'm not sure if it's on here, but I would also check with your employer to see if they have an EAP, Employee Assistance Program. A lot of our housers do, and it might be worth checking in to see if there's some tips or tricks or something that they can do to help you there as well. I see a lot of chats coming in. I'm not sure if anybody, it looks like we're talking about masks and fogging, so I'm going to assume that most of the chats were not related to this, and I'm going to move us along here. Casey, did you want to talk to us about flu vaccines, or I found this stuff on the CDC website as well.
Sure, I can speak to it. This is also off of the CDC site, and they have a whole page on frequently asked questions around flu shots and who should get them. Basically, everybody should get their flu shot, and this if they're over 6 months old. There are some rare exceptions, which mostly have to do with allergies. Especially this year, this is a huge concern because the flu season is likely to coincide with COVID-19 and then put even more burden on our healthcare system and more confusion over who has what and how to treat that. So definitely need to have a push to get people to get their flu shots this year. Essential workers, that's us, need to get our flu shots, and that may be a little more challenging because, for example, we probably won't be having a flu clinic at work. So there's going to be different ways that's going to be rolled out by the CDC, but that's not real clear yet exactly what that's going to look like. I know people were chatting in about getting them to the pharmacist, and that's definitely a great way to do it if you don't get it from your primary care. People with increased risk of severe illness, so older people with obesity, anybody in long-term care should get their flu shot, and definitely people who are at increased risk for complications of the seasonal flu, like children and infants, and people who are pregnant should also make sure they get a flu shot this year, because it is going to be potentially the health system is going to be a lot more stressed. And so getting treatment for the flu, it puts you, if you have to go to the hospital, more risk of getting COVID, more exposure, and all of those things. I see one chat. Anyone heard if the flu season is different from October to April? So no, they are still recommending that you get your flu shot in September or October. If you get your flu shot earlier, like in August, then you could lose some of that protection by January. So the current CDC recommendation is to wait until September or October before getting a flu vaccine.
Casey, one of the questions that came in was asking about, I think hosting flu clinics like we used to do. And I think, honestly, we just don't know yet what that's going to look like. I would expect that we're going to be, kind of watching and figuring it out as we go, and as the flu shot clinic time gets closer to see where we're at. But when we're talking about not hosting group programming and then offering a flu clinic, it seems like a little incongruent. And so I think there's lessons that we could be learning from how people are starting to open back up blood pressure clinics. And I would just say that we will continue to work on that and get any information that we can or guidance that we can out to you as we learn it. But I'm curious if you have any other thoughts on the idea of a flu clinic being held at a site.
I was going to mention that the blood pressure one at a time outdoor model probably will be the way to go with these, but again, we do need to wait for guidance. I kind of envision maybe there'll be some drive-up flu clinics or that kind of thing, but there'll be a lot more about that.
Sorry. Molly said it may be possible to be set up so that individuals are seen in a separate room or done by appointment. Right, exactly. I think those are similar to the things that we're talking about with the blood pressure clinics. And so maybe we can learn some lessons from the blood pressure clinics. It did also, this same website from the CDC did also have some guidance around a flu vaccine being given to someone with suspected or confirmed COVID. So I did go ahead and put this on here, and basically it says that no vaccine should be deferred or postponed during the time at which people are suspected with confirmed COVID. The thing about this that I think seemed the most important to me is just that this could be very easily confused, where people might hear this but then think, oh, I'm not supposed to get a flu vaccine because of COVID. And that's really not what this is saying. This is just saying if you have an active case or a suspected active case, you wait until you are no longer experiencing symptoms to get the flu vaccine. Is that correct, Casey?
Yes, that's correct. And that's because that by getting the flu vaccine kind of jumpstarts or activates your immune system, and you wouldn't want to do that while you were at the same time trying to fight off a COVID infection. So same as, it's always true for the flu vaccine that you don't want to get it when you're currently sick with something else. So you wait a week or two and then get your vaccine.
And then Casey, there's a question that came in about my comment about learning from blood pressure clinics. Could you talk a little bit about sort of what some of the panels are doing to try and restart blood pressure clinics? There's a question in the chat about that.
Sure, yes, some panels are starting to do some blood pressure clinics. They're doing them primarily outside or in a space with really good airflow. And they are doing that. They're not really a clinic, they're a non-clinic in that people come one at a time, equipment and the chair is sanitized in between. So there's just a list of people interested, and then they're called down one at a time. So there's not multiple people in the same area. The nurse doing the clinic is wearing a mask, and again, cleaning between each participant, making sure the participants are wearing masks.
Great, thank you. I think that covers most of the chat. So the next thing I just wanted to mention is that 4th of July, safety. I think normally this would be about how to use fireworks safely, but I listened to this CDC, the Epic Learn webinar. It's they host it once a week, and they kind of go through the top 20 questions that have come in to them from the week. And the one that's on here was primarily around group gatherings, 4th of July safety. How can you celebrate, as normal as you can while still remaining safe? And so I just pulled out some of the recommendations that the doctor had. I wish I had written down her name, but I didn't. It was Dr. Sarah something. But it's in there if you want to listen to it. I will share it afterwards. But the long and the short of it is that outdoors is better than indoors, and physically distance is key. So if you do end up meeting with a group of people, try to do it so that you're outdoors and that you're physically distanced. Interesting point was that a small crowd, all from the same regional area, is going to be much more safe than inviting people from, say, all over the state or your family from out of state. Because every time you introduce a new person from a different region, you introduce a different level risk. If you don't feel well, have symptoms, or have been in contact with someone who has tested positive for COVID-19 in the past 14 days, stay home, just don't go. frequent hand washing with soap and water or hand sanitizer if that's not available, and wearing a cloth face mask. Avoid touching others, including handshakes, hugs, high fives, fist pumps, and don't share objects such as food utensils. So if you are at a picnic and you have, a big thing of potato salad, rather than everyone using the same serving spoon, have people that are going sort of through the line use their own silverware to dish out. That's the bulk of it, but it was a very interesting podcast all around. I would highly recommend people listen to it if they want to. And I think of this not only as guidance for our participants, but also for ourselves, as we look forward to this weekend and to see people that we haven't seen in a long time, just things to consider and ways to stay safe. Again, go ahead, Casey. Sorry, were there questions?
No, I just would like to add to this that, as you probably know, the bars in Texas and Arizona, Florida, I believe, have been implicated with some of the huge rise. And whenever we add alcohol in social gatherings, which is certainly a risk in a lot of 4th of July parties, it increases the risk because people get closer to each other, they get louder. And so whenever you're yelling or talking in a more excited way, you're sending more germs out into the world. So being aware of alcohol too, and being near people who are drinking increases risk. So I just wanted to add that to this slide.
Thanks, Casey. That's a great point. And they talk about anything where if you're yelling or you're cheering or you're singing, anything where you're projecting more than just a normal conversation is increasing that risk of spread. We're going to remind again, I think until the census goes away, we're just going to keep reminding you guys that this is really important. And if we can help our participants complete their census. I know on the last reminder that we shared, someone mentioned that they were waiting for the paper copies, which is absolutely fine, but it's just really, really important that we get that filled out with our participants so that their voices count as well. Future webinars that are coming up. So we have trauma-informed care with Catherine Mabel from NCSS coming up on July 8th at 9 a.m. And this is a staff coordinator and a wellness nurse, a joint call. I've actually heard Catherine present before, and it is a very powerful and informative presentation. I would highly recommend anyone that can listen to it. I've been to a ton of these conversations, and this one was one that I actually walked away from talking about for the rest of the day with anyone that would listen to me, my poor family. COVID nurse call is Thursday, July 9th, and also Wednesday, July 22nd, and the PHL call is July 21st at 9, another typo. Casey, do you want to take us through the quote of the week?
Sure, I found this quote, which I actually can't see out of all the moment, hold on, in VT Digger, and they're talking about some of the arts groups that are working with the downtown to make it safer, and but I thought it really applied to our SASH staff as well, and that is that what this pandemic has done is it's forced us to be innovative. Even though we're all exhausted and drained with stress and anxiety, we're also being asked to be creative and resilient. And all of that takes every bit of energy we can muster. I think that the community is doing an incredible job of mustering that energy. And I certainly feel that is true of all of you and the great work that you're doing with your participants.
Absolutely. Yeah, I agree. And it's just being willing to flex and be innovative that I think is really so important. I do want to share that Kathy Oddie said that there were a couple of bars this weekend in Burlington that were above capacity and not socially distanced, and they were mentioned on the governor's address today by one of the news outlets. So it's just important to know this great information and to take it with you into all different aspects of your life. And that was all that we had for today. Are there any questions left out there that we didn't address? And I will follow up with the COVID email afterwards with all of the great resources that were mentioned here today. As always, if you have any questions that you want to see talked about on here, please just send me an email, southwick@cathedralsquare.org, and I will do my best to make sure that we get them talked about. Thank you all. Have a wonderful and safe 4th of July holiday. and we will talk to you again in 2 weeks.